Okay, so for this video, we're doing examination of the heart. First thing we're going to do is just observe for cyanosis or clubbing of the nails, just to indicate any pulmonary issues, both hands. We're also going to check the lips just to make sure there's no discoloration or anything of that sort. Next thing we're going to do is actually check the jugular venous pressure. For that, I would have her tilt her head away from me. I would observe, using a pen light to help me find it, the jugular veins pulse. Once finding that pulse, I would take a ruler, place it on her angle of Louis, and then I would take another ruler and make a perpendicular intersection. If that were below 2 to 3 centimeters, we'd consider that normal. If it was above, there could be more pathological issue behind it. Next thing we're going to do is we're going to look at basically her chest. Just look for any asymmetries, any lesions, any abnormal pulsations. Notice if she is having any difficulty breathing. Once we do that, we would then go on to looking at her apical impulse. So for that, it would be located right on her left ventricle. On the lower section, I would have her. Can you grab your breast tissue and push up for me for a little bit? For that, I would then look using pen light also to observe, see if I could see the apical pulse, which I can see. If I couldn't see it, I could have her lay on her side to help also find this. Right away, I would then palpate the apical pulse. Sorry, I'm just going to be touching right there. My hands might be a little cold. And just feeling for that normal pulse, making sure that there's nothing abnormal. While doing this also, we'd be looking for any abnormal pulses, such as like epigastric pulse or a subxiphoid pulse, which would indicate also further heart issues. Next thing we're going to get into is then palpating the different valves of the heart. So for this, we would start with the aortic valve, going to the pulmonary valve, to tricuspid, then mitral. The aortic is going to be located in the second intercostal space, so I'll have you grab your breast tissue again for me and pull down slightly. So palpating your second intercostal space, feeling for that pulse, feeling for no abnormal thrill or heave. Then move over to the pulmonary, down to the tricuspid. Now have you move your hands again for me, into the mitral. Good. Once I palpate those areas, I would also palpate the maximum point of intensity, which is basically the apical impulse, which I did earlier. For that also, you would have her lay on her side if it was having difficulty being able to find that pulse. Next thing I'm going to jump into is auscultations. So for auscultations, I'm going to first listen with the diaphragm, listening for any abnormal murmurs or thrushes, which I'm then going to repeat, also going over those specific valves. Thank you. And what I'm also listening for is her heartbeat and the S1, S2 sounds, listening for normalities in that. I would then switch over to the bell and listen even further for S1, S2 sounds. I would then listen for such things as physiological split of S2. I should notice that the S2 would be louder at the cardiac base as opposed to the apex, where the apex would be, S1 would be louder. So for that, I'm then going to listen with the bell. And I'll just have you grab. Thank you. And with that, I didn't hear any abnormalities. I didn't hear physiological split, which would be normal, but I also didn't hear that. I didn't hear any abnormal sounds like galloping or anything of that sort. Uh, Next thing I'd have her do is actually have her sit up for me. this one we're gonna do aortic regurgitation test. So for this, I'm gonna just place the diaphragm over second intercostal space. While she does this, I'm gonna have her bear down. So I ask her to do something that resembles like holding her breath or flexing her abs or something like that. And just listen for any abnormal thrusting of the aorta. So then I'll have you bear down. Good. And with that, there was no abnormal sounds, no abnormal thrushing that would make me think that she could possibly be having issues with her aorta. I'll then have her lay back down again. Now, initially in the exam, this is something that you probably listen for while you're going over each valve, but right now I'm going to be listening for mitral prolapse, making that MVP sound. So I'm going to go over mitral valve, listen with the bell, and just to make sure that there's nothing abnormal with that. And yeah, with that, there is no abnormal sounds. Everything seemed to be normal, indicating that she doesn't have that disorder.